Waterborne diseases, CM 3.3, etiology and basis of jaundice, hepatitis, diarrheal fever. My name is Dr. S. Suganathan Soundararajan, Assistant Professor, Community Medicine. Learning objective. At the end of 1 hour session, participants should be able to define waterborne diseases, list key etiological agents, describe the basis of diarrheal diseases, describe the basis of hepatitis A and E, explain jaundice as its symptoms, describe the basis of typhoid fever. What is a waterborne disease? A disease caused by pathogenic microorganism transmitted through contaminated water, can be due to ingestion or contact, primarily spread via fecal-oral route. The mechanism of fecal-oral route, which I have illustrated as a picture. This is the primary mechanism for waterborne disease transmission. Pathogen from feces contaminate water supply which are ingested. Etiological agents and overview. Pathogens are broadly categorized as virus, hepatitis A, rotavirus, bacteria, cholera, typhoid, protozoa, giardia, amoebiasis. Key bacterial agents. Vibrio cholerae creating the cholera, Salmonella typhi causes of typhoid, E. coli is the EHEC, Shigella dysentery, Campylobacter jejuni. Key viral protozoal agents. Viruses, hepatitis A virus, that is HAV, hepatitis E virus, HEV, rotavirus, norovirus, protozoa is Giardia entamoeba. Diarrheal diseases defined by an increase in loose stool frequency, liquidity, or volume, a major cause of morbidity and mortality, especially in children. Diarrhea cholera. That is the etiology is Vibrio cholerae, a gram-negative motile comma-shaped bacterium transmitted by contaminated water or food. Basis of cholera. Pathogenesis. Bacteria colonize the small intestine. They produce a powerful enterotoxin called as the cholera toxin. Basis of cholera. Toxic action. Toxin activates adenylase cyclase, causes massive secretion of chloride, sodium and water, inhibits sodium absorption. So that only when there is a severe dehydration, ORS is given as a first line of treatment. Cholera clinical feature results in profuse watery diarrhea, rice water stool, grey turbid fleck of mucus, severe dehydration and then shock. Diarrhea, rotavirus, etiology is rotavirus, basis virus infects and destroys mature enterocytes in small intestine, leads to malabsorption and osmotic diarrhea. Waterborne hepatitis. Hepatitis means inflammation of the liver. Waterborne type are A and E. Both are transmitted via fecal-oral route. A. That is the hepatitis A. Etiology is hepatitis A virus, a non-enveloped RNA virus, highly resilient in environment, transmission, contaminated water, food or close contact. Basis of hepatitis A. Pathogenesis is virus replicates in the liver, that is affecting the hepatocytes. Liver damage is caused by body's own immune response, that is T cells, does not causes chronic liver disease. Hepatitis E. Etiology is hepatitis E virus, that is the HEV, and RNA virus transmission, fecal-oral route via the contaminated water. Zoonotic from undercooked pork. Basis of hepatitis E, that is the pathogenesis similar to hepatitis A, causes acute liver inflammation, usually self-limiting, can become chronic immunosuppressed patients. Hepatitis E in pregnancy, high risk groups are HEV, that is the hepatitis E virus infection in third trimester is extremely dangerous, can lead to fulminant hepatic failure. Mortality rate can be 20 to 30 percentage. Part 3 is jaundice. Jaundice or icterus is not a disease, it is a clinical sign. Refer to the yellow discoloration of the skin, sclera eyes, and mucous membrane. Basis of jaundice, that is a pathophysiology caused by high level of bilirubin in the blood, hyperbilirubinemia. Bilirubin is a yellow pigment from breakdown of RBCs, that is the red blood cells. Jaundice in hepatitis mechanism, hepatitis A or hepatitis E damages liver cells hepatocytes. This damage impairs the liver's ability to conjugate and excrete bilirubin. Bilirubin builds up in the blood. Part 4, that is the diarrheal fever. I am coming. That is the asystematic illness. Fever originates from GI tract, gastrointestinal tract. Classic example is the typhoid. Enteric fever in typhoid. Etiology is Salmonella enterica, Cerevisiae or S. paratyphi or paratyphoid, a gram-negative bacterium. Basis of typhoid, that is the pathogenesis. Bacteria are ingested, invade the intestinal lining, that is the pear patches, are engulfed by macrophages and multiply, enter bloodstream as bacteremia. Typhoid clinical feature, high stepladder fever arises daily, abdominal pain, pea soup, diarrhea for constipation. In right side picture you could spot some rose spot in the abdomen, and that is only I have mentioned as rose spots on abdomen. Prevention and control. To prevent the disease, there must be a clear knowledge, attitude, and awareness and practice among general population. Apart from that, strategy is to interrupt the fecal-oral route at multiple points. This is the main core aim of the community medicine, to prevent the community from spreading of all aspects of communicable diseases. Water and sanitation. Key intervention is provision of safe, clean drinking water, that's by chlorination process and filtration, proper disposal of sewage, building and using sanitary latrines. Hygiene, vaccination, personal food hygiene, hand washing with soap, washing fruits and vegetables, cooking food thoroughly, and vaccination, typhoid, hepatitis A. Thank you all.